Right after your patient finishes their session, what do? We all have our own routines that we like to follow, right? We might ask them if they have any questions. We might confirm their next session. We may check a measurement that we want to follow up on that we saw in the beginning. And all these things are great. However, a lot of us miss one simple strategy that can totally change their patient's experience. And this strategy is an exercise checklist. And in this video, we are going to dive into why every single exercise should have a checklist and the many benefits that it can have for your patients. How many of you have had a crazy successful session with your patient where everything went perfectly? The exercises you prescribed were great, it improved mobility, it decreased their pain, and they left feeling wonderful. Fast forward to the next session when they come in and they say they're in worse pain compared to when they saw you last. They feel stiffer and they don't know if the exercises helped them or made them worse. How many of you can relate to that scenario? This is because we are not employing our patients with strategies to be successful at home. This is where the exercise checklist comes in. The exercise checklist is their step-by-step guide to ensure their success. What I mean is, if they go to do their exercise and they feel confident from how it went in the clinic, but something doesn't feel right when it's at home, they have the steps to go back to and look at to make it feel right. And when I'm talking about an exercise checklist, we're not talking about the generic printouts that anyone can Google and it has random steps that someone should follow. I'm talking about making it specific to the patient. What should be included in your exercise checklist are the steps, the proper setup, proper coaching cues that's specific to them, meaning putting it in a language they understand, where they should feel it, where they shouldn't feel it, and then the proper dosage, right? Sets, reps, all of that. But that is going to be their bulletproof way to make sure that what you saw in the clinic is going to be transferred to how they perform it at their home. Another cool benefit of the exercise checklist is that it either consciously or subconsciously raises your coaching standards. You have to remember that you are a movement expert. You understand anatomy and movement. But what you need to do is change your perspective and put yourself and change your mindset to a movement novice. A lot of times we like to throw out anatomical and medical jargon that doesn't make sense. It doesn't make sense to our patient and they don't care. And it's going to start to decrease the value of the exercise because they don't care. So for example, what we need to do is, let's say that we are coaching someone through a posterior pelvic tilt. When we go through that, if we're in the clinic we use those terms, posterior pelvic tilt, and we show them, yeah, they might be able to do it. But when they go home, they're going to remember posterior pelvic tilt. They don't know what those three words mean. And they really don't understand the motion, right? The words don't help them execute the motion. So on your exercise checklist, this is what we replace it with. Instead of posterior, we say what? Towards your chin, okay? Next, instead of pelvic tilt, we say belt buckle. So we've now replaced posterior pelvic tilt with, I want your belt buckle to turn towards your chin. So we changed our language. We are giving them the power. We are teaching them the how and the why behind it. We're not just getting them to repeat what they did in the clinic. We're actually trying to have them learn. Because once they learn, that's what's going to start to stick. That's what's going to give them that pain-free life that they're looking for. Again, this is just one example, but the big thing is we need to change our language so that we are giving the power to the movement novice and making him feel like a true movement expert. The final benefit of the exercise checklist is you will see patient satisfaction go through the roof. A lot of times when we're dealing with patients that we would typically say are unmotivated or they could care less or they're just using the system, I want you to challenge that and look at it in a different way. They may be responding to physical therapy like that because they don't know the how and the why. They've never been given strategies to set them up for success. What you'll find is that when you provide them with the strategies, aka the exercise checklist, you will start to see them respond differently. They now see the value in physical therapy. They are now going to put more effort in. It is going to completely change their experience, and it's going to lead to an experience that gets them out of pain. The best thing that comes from this is that you change from being a physical therapist to their physical therapist. So you now see the value and the benefits of a checklist, but let's put it all together with an example. So a classic physical therapy exercise is a bridge. So I wanted to show you an example of my checklist for a bridge so you can compare and contrast the usual print off that is given to the patient. Now I'm going to keep on looking down to go through the checklist, and then each step I'm going to break down my thought process and what's going on there. And what I really want you to pay attention to is how each step really serves a function and a purpose, right? Everything's intentional, and everything is bringing us closer to get that intentional result that we are looking to achieve. All right, so we're going to go over a bridge. So first, lay flat on the ground, bend your legs, and have a band around your knees. Pretty self-explanatory, but again, a lot of people miss that step. They might not know where they need to be and do they need to have their legs bent, right? Next, press your midfoot and heel into the ground. So notice how we're saying midfoot and heel. We're trying to engage more of the posterior chain, the hamstring, the glutes. And what we're trying to do is start to activate these things before the patient actually moves, right? A lot of times this person may have back pain, so it's going to be beneficial to start to activate the glutes, the hamstrings, before movement occurs. Next, clown shoes. I always like to give people coaching cues that I tell them in the clinic. So clown shoes is a great example. Clown shoes, what I like to do is say, hey, Mr. Jones, are you familiar with clown shoes? Typically they say yes. Then I say, okay, so you know how they're really big. Yeah. So what I want you to do is imagine you're wearing a size 15 size shoe or clown shoes. And I want you to pull your heel back in your shoe because there would be so much space where your foot is in the back of the shoe. So what are we doing? We're cueing an isometric hamstring contraction. But telling them to just engage their hamstrings isn't sufficient for a movement novice, right? Now we're getting them to visualize clown shoes. Okay, I see that. I can pull back. Boom. Wow, yeah, I feel my hamstrings. So it's a really easy way to get them to cue into the hamstrings. Next, I'm going to tell them to maintain their pressure with the band. So I don't want them pushing out, and I don't want the band to push them in. I like to do this because I want to see, does the pelvis have its relative motion, right? When you go up into hip extension, the pelvis needs to be able to move into ER and IR and back to ER instead of our femurs driving a pseudo ER, IR, ER. All right? So now they know what to do with the band because again, you put a band around someone's knees and you just tell them to push, they're going to push, right? They're going to really go for it and it's going to change the outcome. So make sure you address that. Next, you should feel your glutes and hamstrings prior to movement, right? So I probably would have already said that, but now I'm reinstating that before we actually move because the steps we just did should have turned on the glutes and the hamstrings. Next, I want you to maintain your glute and hamstrings while you push your hips to the ceiling, okay? So again, we used another cue that they understand, the ceiling, right? I need to get my hips up to the ceiling compared to just saying I want you to bridge up, right? That doesn't make sense as much. I want you to feel your hamstrings and glutes as you raise up your hips to the ceiling, right? Very specific, and again, putting it in terms they understand. Next, aim to have your hips in a straight line with your shoulder. So instead of saying, I want you to achieve full hip extension, right? I want you to try to have a straight line. It gives them a target. It gives them a visual that, okay, when I go up into hip extension, my hips need to be in line with my shoulder, right? That's going to be the straight line. That's essentially going to be their full hip extension. Next, 3-second hold, right? So we're just going to have 3-second hold. Maintain glutes and hamstrings on the descent, right? A lot of times people just flop. They don't think about the descent. Now we're cueing them, hey, this is when your back pain probably kicks in. I need you to make sure and be confident you feel the glutes and the hamstrings. Now, a side note, if they didn't know what the glutes and hamstrings were, that would be said during our sessions so they understand that, right? But you could always substitute that with your butt, your back of your hips, right? You could use interchangeable words there. Then I'm going to tell them to tap the bottom and repeat 12 times, right? So tap the bottom because I don't want them to lose what they just got, right? I don't want them to go down and relax. I want them to keep everything, to try to build this endurance of the bridge and to keep that repetitive motion going, right? So we're tapping the bottom or the floor and coming back up. And then the last thing I'm saying is you shouldn't feel your low back, right? Super common that patients feel their low back when they go into hip extension. If they do feel their low back, this is the checklist they should go back to. Did you lose your heel pressure, right? Specifically that posterior aspect of your heel. Did you lose the band pressure? Are your knees caving in? Are you pushing way too much out? Are you not maintaining like I said, right? Are you feeling the glutes before you go up, right? So all these things they can go back to. And this is how you can get really purposeful, really intentional, and get the outcomes that you're looking to get with your patients.